Sure, I just started the recording, so roll call. Miss LaFrance?
Here.
Miss Quinn Davidson?
Here.
Miss Allard? Mr. Constant? I see him on there, but I don't think he... Mr. Dunbar?
Here.
Mr. Rivera?
Present.
Miss Solotel?
Here.
Thank you.
Do we have any other assembly members present? I don't see anyone on the list, but just checking. Chris, you're there, right? Well, he's muted, but he appears to be on there. Well, good morning, everyone. Thanks so much for participating in this committee meeting. Just as a reminder, if members have questions or want to be in the queue, go ahead and type non-substantive requests to talk or anything in the chat, and then I'll share that with everyone listening. You may also text me, but probably the chat is easier. Let's go ahead and get started with 3A, and we'll get an update from Natasha Pineda.
Hi, good morning, everyone. We haven't done an actual report update in a while, so I am going to run through it. I'll try to be brief, but there is quite a bit going on here at the health department. As far as policy recommendations, we are working on developing a policy statement recommendation on racism as a public health crisis, and we hope to have something to the mayor and the assembly in the next 30 days. Code revisions, nothing has changed there. There's 3 sets of codes that still have updates that are necessary, but honestly, they are really low priority at this moment. At the cemetery, and the main thing I wanted you guys to be aware of is that our contractor is a few weeks behind in getting grave markers installed, which is creating pretty upset families. So that may be a complaint that you may be hearing about. It is something we are aware of and working hard to rectify. In our administrative division, about 40% of our staff are continuing to respond to COVID-19 in a variety of different ways. Let's see, our request for grant proposals for the homeless camp outreach was awarded. 2 grants were awarded, one to Choices, one to Rural Cap. Those in groups were starting effective today, so that work should be starting. The RFP for adverse childhood experiences, the proposals have been received and are being evaluated by the evaluation committee. Final scoring will happen on the 7th, so you should see some documents for approval coming in a future meeting. The Human Services Community Matching Grant was awarded to us by the state. We got notice of that yesterday, and the proposals have been received and are being evaluated by an evaluation review committee. So that will be coming to you as well. We are starting to get our responses from the state for approvals for our grants. I was going to pull up just a FYI. We've been awarded 1, 2, 3, 4, 5 out of 8 of our state funding. We're about short 150 total, 150,000 in with 4 different grants that had a decreasing amount for us. So we'll be working on addressing that hopefully in our budget. Let's see. We are working on our capital budget to provide to the mayor and then hopefully to you guys. There's multiple issues, including the health department's facility here, some improvements that are needed. The animal control reopened on June 1st. Safety protocols are being implemented and staff are doing services. So that's great to have that open. On the emergency preparedness end, obviously, we continue to be very busy. As I said, we have about 40% of our employees are working that issue. We did finally complete the mass gathering checklist and application process for large events over 500. We are continuing to coordinate with the police department and the municipal traffic engineers to support traffic control and management at the Lake Otis testing site. In addition, we're working on implementing a comprehensive testing strategy within Anchorage. So the EOC is currently working on acquiring more contracts to get more testing, which would hopefully relieve that site. So more to come on that. Childcare licensing, they're continuing to partner with the state, communicate with organizations, and we will be working to get out the CARES funds with an application process in place by mid to late July. That's a question that's come to us a few times. So that's what we're shooting for. The HUD program in the community systems development section is having an audit right now. So they've been going actually through an audit throughout the pandemic and are continuing to do a good job in response to all of the different kinds of questions. We have multiple, the second rounds of the CDBG funds for the CARES Act came through. So some of you may be aware that we received about $1 million in CDBG, 521,000 in ESG, and then an additional 3.7 million in ESG. So that team will be continuing to work with the mayor's office and community partners to recommend how best to use those funds, although the priority continues to be moving people out of shelter into permanent housing as quickly as possible. ADRC has been very busy serving individuals, families, and continuing community partnerships. And let's see, Safety Patrol responded to over 2,000 calls in the month of May, completed 744 transports, and performed 851 intakes in that same month. So they've been very busy. The public health section, the environmental health services team is very busy while working virtually and in the office, is starting to get out and doing inspections in different locations. The WIC program continues to be able to provide services remotely. As it relates to public health nursing, our disease prevention team has reached out to over 100 contacts for 2 large tuberculosis outbreaks that are connected to 2 local businesses over the last 30 days. So while our team has been pretty busy with COVID, we also continue to do work around tuberculosis and syphilis, which are both areas of increasing concern. As of today, actually this is as of yesterday, we were monitoring a total of 229 cases, 332 contacts for a total of 561 municipal residents for COVID-19. That doesn't include the 17 new cases that we received yesterday. So we are at a point where we have maxed out our public health capacity. We, in the last 6 days, have had 77 new resident cases, and that is over 20 more than the previous reporting period, which had an additional day. So I'll be getting a report on Friday that you guys will get on Sunday, which will mostly show a pretty significant increase in positive cases. So we're very busy, continuing to be so, and that is my report for today.
Thanks so much, Natasha. Did you say that the childcare money will be hopefully getting out into the community by mid to late July?
I think their hope is that they would have an application out in the community and be getting it distributed at the end of July. Okay. But that's probably aspirational, but we're really hoping to do that.
Okay, great. Thanks for that update. And then when you said we've maxed out our public health capacity, can you explain a little bit more what that means? And if anyone else has questions, obviously feel free to let me know in the chat.
Yeah, so what that means is last week we were already in like the yellow zone where our nurse team could not make all the calls to every positive case for contact investigation. So then we started asking for support from the state and the Arctic Investigations Program. So they've been carrying a large load of our case contacts. And then in addition, now we're struggling to call through 561 people every day. So we've moved, along with the state, we've moved from a posture of calling everyone every day to about a week and a half ago. And I can get an exact date where we moved to a 1, 3, 5, 7, 14 day calling cycle, to now yesterday moving into a position where the goal is to call every contact at least once, and then if upon nurse's discretion to call them more frequently. But we simply just cannot keep up with the number of cases and contacts that are required. So we're working to try to bring on more capacity. The state has some database tool that they're bringing on that hopefully we'll all have access to in the very near future. Staff are training. UAA is bringing on staff, but for currently, probably for the next 10 days at least, we're in a posture of red light. We're reaching our capacity, and we cannot guarantee that we're connecting with every single contact.
Thank you. I had the opportunity a little while back to participate in a meeting with a new company that's doing contact tracing through an app-based program that follows people and sees who they interacted with, and then that information is made available to public health experts. Do you think that's something that would be of use here, or is that what you referred to that the state is exploring?
Well, the state is working on it's a program called Damaji. It's a database tool where all the public health offices around the state and then the contact tracers that UAA will be training through their program can work from, and we'll all be able to see what everyone sees. We can see contacts and cases and follow up. It has all sorts of ways that it can interact with apps and other tools. But the important thing for Alaska is that we have an integrated system that both the state and we can see into the same place, because right now we're in a situation where we're using, Excel spreadsheets and the state's NBS database and trying to connect information manually, which doesn't work. So there may be some great tools that can be applied to that CompCare Damaji product down the line. The main goal right now is to get everyone trained and on the tool and capable of using it so that we could increase the volume of contact tracers pretty much immediately once that tool comes on. It's just that it's not online yet in a way that's that we can maximize at the local level.
Got it. So there's still more efficiencies to be done before we move on. Okay. Mr. Dunbar has a question. Go ahead, Mr. Dunbar.
Thank you, Ms. Quinn Davidson. Ms. Pineda, so one thing that I have been puzzled about in the last couple of weeks, and I realize you might not have a concrete answer for this, but maybe you could give me a little insight, is although we've seen this large rise in cases, we haven't seen this sort of concomitant rise in deaths or even hospitalizations, it would appear. And so first, I guess, correct me if I'm wrong, if actually hospitalizations have increased significantly. And then, at first I thought it was just because it was a lagging indicator, but the spike started several weeks ago. So you'd think that people would be starting to perish or at least be hospitalized. Can you give me any insight into that?
This is my personal observation, as we looked at some of that data last week, and we know that most recently we've had a lot of younger cases. I think throughout we've had more younger cases than normal, than our population. So about 20% of the cases. Pardon me, let me pull it up. Anyway, I'll find the data point. I think I shared it in the report to you guys on Sunday. That people between the ages of 20 and 44 are making up the larger percentage of the cases in Anchorage. And that's because we have a younger population, right? We have a healthier population. There's all sorts of benefits to that. However, we're already starting to see, for example, young people out, having a great time, getting sick, and then going to work in, say, a medical facility where there's highly vulnerable elders in that facility or people with chronic diseases. And so it still is a lagging indicator. I believe the math and the algorithm will play out in some time in the next 3 to 6 weeks. We'll start to see increases in hospitalizations and medical support for the population. It just takes a while to get to the grandparents or to the others. So right now we just have a larger number of cases that are younger. So I think we'll see it. I don't think that we will miss that opportunity, I guess, as well, it's not an opportunity. it'll come.
Thank you.
And I just want to let everyone know that Mr. Weddleton is on the phone as well. Any other questions? Thanks so much, Natasha Pineda, for that comprehensive update. Any other questions from members? Okay, we're going to move on to the early literacy program discussion, and that's going to be led by Library Director Mary Jo Torgeson, maybe Claire Ross as well. This is both 3B and 3C are in the context of the alcohol tax potentially, and what we can do to put together. Oh, and Mr. Constant just let me know he's on the phone as well. So I'll let you go ahead, Mary Jo.
Great. Thanks for this opportunity, Assembly members. We presented a white paper to discuss the early literacy, and it is in keeping with the alcohol tax. We're part of a coalition that has been meeting to figure out ways to attack many of the problems in Anchorage, and we can be involved. The library can be involved with a lot of that. At no additional cost. However, the early literacy portion of trying to improve the lives of children and getting them ready for kindergarten is where I think we do need help, and we have the expertise. One of the issues that certainly has come to light, and it fits within our strategic plan, is equity, diversity, and inclusion. And when you look at the children that are really failing the most, it is in communities of color. And that is the thrust of this request, is to provide a new librarian, a pilot project similar to what we did with social worker, but this would be a pilot project reaching to communities of color outside the library, providing training to parents and caregivers around why it's important to read. Why it relates to this particular tax is just from an angle of good parenting. When parents read to their children, there's a nurturing that happens, and to also bond parent and child, or caregiver and child as well. So that's what this request is. We have not been able to really touch the 60% of children that are not kindergarten ready. I mean, the numbers are absolutely huge in this community, and the community will continue to fail without additional resources. I also have Elizabeth Nicholas. Yes.
I'm sorry for interrupting you. I can hear you well, but Mr. Weddleton is having a hard time. I suspect folks on the phone. So if you can just speak, if any of the speakers can speak as loudly as they can, that would be great. Sorry about that.
Oh, that's okay. I also have Elizabeth Nicolai. She's our youth services coordinator to also speak to this as well. Elizabeth?
Hi, I'm just here to echo, started with Mary Jo, and I'll give you, I'm sure you've all received the white paper. So sort of the 3-sentence high-level overview is this would be an early literacy outreach position that would focus in communities in need with our existing partnerships, that we have a long track record of partnerships with groups like Thread, the Anchorage School District, Title I preschools, the Head Starts around town, and other places. And we would focus both on direct service to children as well as training of caregivers, formal caregivers, and informal unpaid caregivers, what are often referred to as kith and kin caregivers, to try to help people realize the best potential for early literacy, behaviors that are really simple and fun to do within the home and in the caregiving place. So it would be a position that would be dedicated to those outreach goals and to trainings and services within other communities. This position would also be funded to include giveaways of books and other early literacy materials for families to do. As Mary Jo said, in the Anchorage School District, 31% of our students are meeting 11 out of 13 of the goals in the Alaska Developmental Profile when they enter kindergarten. Only 41% of our students are demonstrating phonological awareness, which is to say knowing their letter sounds when they enter kindergarten.
Before you ladies move on, I have a question from Ms. Salatel. Ms. Salatel, go ahead.
Thank you, Madam Chair. I'm really excited about this idea and this program. Could you talk a little bit to me how it might look in a COVID world, some of the outreach efforts? You know, everyone's been missing their library significantly, and we've only been able to now get to curbside pickup. So can you just walk me through, I'm quite the pragmatist, so like how it might look in terms of reaching out to these families and still, you know, doing a great job at keeping everyone safe?
Do you want me to take that, Mary Jo?
Sure.
Okay, we've been talking about that a lot with this program specifically, but in library services in general. We already have a social media presence that reaches people in the platforms they're already using, Facebook or Instagram. We are also a partner with a texting service from Alaska Public Media called Bright by Text, where we help provide content around early literacy text messages that goes to caregivers' phones. I get them for my own daughter, and they're fantastic. And so it would be a matter of continuing and really focusing on electronic communications, purchasing books for giveaways in bags and early literacy materials that could go to people's houses that wouldn't have to be returned to us or worry about quarantine or people leaving their houses if we return to, for say, a hunker down situation, that these would be materials that would be available within their homes. And we would also, we've worked with some electronic communications, as well as for like training. We've got some canned trainings, and we're working to develop some more trainings that are on YouTube and WebEx and other online softwares. I know we have a separate grant that's around purchasing, that's out for, I believe, federal funding that's around purchasing laptops and MiFis that could be partnered with this program to help people get the access to even access training materials we produce.
Yeah. In addition, the premise of this position is really also design thinking. In the same way, for our strategic plan, we reached out to the community to talk to them to find out what changes they would like. That would be a strong drive, even in a COVID environment. That would be part of what we would be doing, and hopefully we would have a community-based plan moving forward post-COVID.
May I ask a quick follow-up, Madam Chair?
Sure, and then Mr. Weddleton's next.
Thank you. Yeah, so my concern with the electronic piece is I think the ASD data has been pretty clear that we have quite the disparity. And so I'm really happy to hear about the federal grant, but I guess it's a comment / thing to ponder is if we don't have a grant or something, how do we work on that disparity around electronic communication and engagement? So I just wanted to toss that out there. That's been weighing on my mind quite a bit as we saw that data come out from ASD. Thank you.
John, go ahead. And you might be muted. Mr. Weddleton, are you there? Okay, he did have a question, but maybe he's muted. So are there any other questions, or did you want to, is there more you want to talk about in the presentation?
No, that.
Great. And so is there additional information than what you sent us in the written proposal? Is there anything you want to supplement, or should it all be contained within there as well?
I think the white paper, unless the assembly members are requesting additional information.
Okay, great. Just for members who weren't here,
Okay.
it's nice to be able to refer them to that white paper. And are you two ladies hanging around in case we get John back and he can ask his question later?
Yeah.
Absolutely.
Terrific. And just so all you know who are listening, we tend to do our Teams meetings without video, but I love personally to see the presenters. So the rest of us aren't on video, but don't get deterred, and thank you for showing us your lovely faces. And Mr. Weddleton is working on unmuting, so you just let me know. Go ahead and just pipe up when you're there, John. Or now that Tiffany's beginning, perhaps we could just wait until later. your choice. So let's get going. Tiffany Hall from Recover Alaska has been working with Trevor Stores and others. I'm sure she's going to explain it on a strategic plan, giving us a framework and guidance on how we could spend alcohol tax money to achieve the best results. So Tiffany, go ahead.
Great, thanks so much. Can everybody hear me?
You're a little quiet, so I'm guessing that John might have a hard time.
Okay, I will just try to speak loudly and get closer.
Great.
I'm Tiffany Hall, I'm the Executive Director with Recover Alaska. I have gotten to work with many of you, and thanks so much for letting us be part of your meeting today. And just to kind of preface why Recover Alaska is getting involved in this process, people were reaching out to us, asking us to, and people meaning other providers, providers of treatment services, providers of homelessness services, people who were involved in the campaign or watching the campaign for the alcohol tax as it happened. And I was out for 12 weeks, and when I got back, I had a long list of people who were really hoping that we would get engaged and we would help other people get engaged, which to me is exciting because I think it's a lot of people who maybe don't regularly engage with this public process and with the assembly. And so to me, it's a great step just to have people wanting to be involved. So as Austin mentioned, we were working with Trevor Stores with the Alaska Children's Trust, as well as Dr. Monsager, who's on the Homelessness Leadership Council, and we worked with Agnew Beck to help us pull it all together. Partially also because I know that I'm not the be-all, end-all of information and of how the revenue would be best spent, and so we wanted to make sure we were engaging as many people as possible. Also to say, we know that this is the Assembly's process and we're not trying to overstep. We're just trying to help pull together thoughts from various subject matter experts. Maybe some of that is happening behind the scenes, but I'm not fully aware of it and other folks weren't fully aware of it. So we just were trying to get people together to hear thoughts about this. And we started with a group of close to 100 invitees, and we asked people to kind of spread the word and think about who we were missing. And it quickly and organically grew to a group of over 225 invitees. We've had 3 meetings so far, and we usually have between 50 to 60, sometimes upwards of that, people involved on those calls. I sent a document. We sent a document yesterday, so hopefully you've had a chance to take a look at that, or you can have it in front of you right now. And I'll just kind of walk through it a little bit. I know that we have a short period of time today, so I'm not going to go through all of it in detail, but I'll just kind of do a high-level overview. So starting with the vision, we came up with improved safety and well-being for all in Anchorage. And we had a lot of conversation about what safe means and how that can mean really different things to different people. The same with wellness. And we also talked a lot about what all means and making sure that we are thinking not only about business owners, but also about people experiencing homelessness, and not only about treatment providers, but also folks who might be needing those services. And I see that there's a question in the chat, which document. It was hopefully attached to a meeting announcement. It's called a Draft Anchorage Theory of Change. I don't know the best way for me to get it out.
Tiffany, I was just going to try to do this myself, pull it up, but I bet Carissa has just done that for us. So can you see it on the screen?
Yes, perfect.
Okay.
Thank you.
And, you know, I'm looking, Tiffany, you sent this to Suzanne and I yesterday evening, but and to Carissa, but it might not have gone out to all members. So.
Oh, great point. Sorry about that. We were just thinking that I didn't know if it automatically got distributed, but we can, after this meeting, I won't try to do it right now. After this meeting, we'll make sure that all Assembly members do have it.
Carissa can distribute it. She's on that email. I'm sure she'd be happy to. Okay, sorry, go ahead. Thank you very much.
Thank you. So that's sort of the vision of where we wanted to go. And then in terms of the community-wide goals, this is sort of what we want to achieve. And I know, like, bear with me for a minute, because I know that this might sound broader than the three kind of buckets proposed in the alcohol tax. And if you look, I think numbers 5 through 9 address more specifically what was highlighted in the alcohol tax. But through this process, we realized that all of the other goals are also quite relevant. And we know that alcohol is not only a cause, it is also an effect of a lot of these other things. We need to not only address domestic violence, sexual assault, child abuse, and homelessness, but all of the other traumas and inequities currently in our system, poverty, all of these are kind of tied in with alcohol. And so we wanted to think big and be creative and optimistic. And we know that we won't be able to do all of this at once. So we wanted to increase engagement with municipal decision making. We want to make sure that the improvements we're seeking are measurable and that they work across systems. We know that prevention works better when you can address multiple issues at one time. We really wanted to make sure that we were thinking about social determinants of health and equity and racial disparity. And we wanted to think about wealth and poverty and how those play a role in all of this. And then kind of 5 through 9 include directly the impacts of alcohol and substance misuse, reduced rates of child maltreatment, sexual assault, domestic violence, number of people experiencing homelessness, and the number of people with behavioral health conditions who are held in jails. And then reduce suicide deaths of youth and adults, I think, is a really good goal that's attached to a lot of these things. In terms of the guiding principles, this is how we want to do the work. And what we were hearing a lot from folks is to try to make sure to engage as much as possible with not only providers in the field, but also communities with lived experience and communities who are experiencing impacts of these things. Nothing about us without us. And everyone who we talked to also wanted to make sure to try to think about root causes and invest in long-term prevention. I know that part of this money should go to immediate treatment needs and helping people who are dying. And that's kind of the tertiary prevention level, right? Like trying to prevent that, trying to help people who are in immediate need. But this is also a very unique scenario of having sustainable funding that can be used for prevention. And we hardly ever see that. And so we just want to make sure that that is not lost, and that by addressing prevention, we know that it's between 7 to 20 times more effective than treatment dollars. And we know that we will eventually see less need for that immediate treatment if we invest in prevention. And that can kind of be agreed upon across the board with everyone who we've been speaking with. We also want to make sure that we're thinking about leveraging funds, especially with this CARES funding and some other kind of buckets of money that we weren't anticipating. We want to make sure that we can think about how to use some of those short-term dollars in conjunction with these long-term sustainable dollars. And we also want to make sure that we're thinking about innovation, and the piece of the charter amendment that says, you know, we should think about new dollars and not just kind of backfilling or doing what we've already been doing, but think about how this can be used in new ways. And then moving on in the document, sorry, I'm trying to move quickly here. In terms of the why, in the focusing on will help us address and will meaningfully reduce issues. These are kind of laid out in this primary, secondary, tertiary levels of prevention. So kind of the high level broad-based solutions, and then looking at solutions that will help prevent complications from issues, and then looking at things that will help prevent kind of death and more dire, the immediate outcomes. So all of this is just to be used as a framework for how we think about these investments holistically. We talked throughout the first months of the year during the campaign about the alcohol tax, about prevention. We know that polling showed it's what people want. People want to see reductions in child abuse, sexual assault. People want to see more treatment for substance use disorders. People want to see mental health options or possibilities at tied with first responders, when people call for emergency help, what else can we do to make sure we're addressing some of these root causes again? And so in our process, we kind of, and then if you keep scrolling down in the document, you'll see this logic model. And I'm not going to try to go through all of that right now. It's a really big document. I'm happy to talk through it one-on-one with folks, or we can maybe set up another separate work session just for this, but also just to kind of let you know where we are in our process. We've had 3 meetings so far, primarily looking at these vision and guiding principles, but also looking at this logic model. And everyone can, they're still weighing in, but so far this feels like a good place we've gotten to with the entire kind of large group. And what we were hearing now is that people would like to break up into buckets, the 3 buckets outlined in the tax, to talk about actual dollars, actual programs, actual outcomes. So we were hoping that we would already have some of that for you by today, but we're moving as fast as we can, but we just haven't gotten there yet. And so we are trying to come up with some recommendations to go into your thinking. We also understand that you are probably doing this work as well. Again, I know it's your process, and I don't know how much you've already had a chance to work with subject matter experts. Maybe that's happening behind the scenes. I just know that some folks were wanting us to look at it, and so we're going to hopefully provide you some recommendations to say, here's the framework we hope you will consider using as you make these decisions, and here are some specific recommendations, which might include things like the project that the wonderful folks from the library just presented, might include things like a crisis now type model, might include a way to do more substance use disorder treatment, but we're not there yet. I know that Recover has some ideas about what we think, but I don't want to misrepresent this larger group. So I will hold off on making any of those recommendations. And then the last piece that I'll say, I see that there's a question, but we also just are here because we want your take and we want to understand what you're doing and what your thoughts are, and if we're completely going down the wrong direction, and how we can support your work and work together in partnership.
Thank you so much, Tiffany. Ms. Salatel?
Thank you, Madam Chair. Yes, thank you, Ms. Hall. I appreciate that last sentence because the Assembly has been, under the leadership of the chair, really digging into this work. And my question was, how do we, or do you have some thoughts about where this fits with where we're kind of at in our process? So we've been going through our subject matter expert discussions in committees, and then we'll be reconvening, I believe, next month, and then moving to our town halls. Sorry, my brain is processing a little slow today. So I would just like to have you kind of talk with us a little bit about how this draft logic model and the work that the community partners here are doing kind of fit into where we're already at, so that maybe we either cross paths or don't run on parallel paths to integrate the work.
Through the chair, thanks very much for the question. And I will be really kind of upfront and honest and say I don't know exactly where you all are at in your process. I've kind of listened in to meetings as I've been able to. And so I would love to learn a little bit more if you already have big ideas and just need help refining, or what the process has been in terms of engaging with subject matter experts. I don't know exactly where that stands. And we, of course, wouldn't want to do anything that is hugely in contradiction, and we don't want to duplicate work, right? Like if you all are also meeting with all of these different subject matter experts, maybe there's a way that we can work together and combine our resources so that we don't run parallel. That's not really what we would like to do. Again, Recover got engaged in this work because a lot of people were asking us to, and I think probably it's just because we were pretty visible in the campaign to get the alcohol tax passed. This isn't work that I was anticipating doing ahead of time. I kind of thought, great, we'll hand it over to the Assembly and that will be that. And I'm not trying to step on toes. It's just that people were reaching out to us. And so hopefully some of this aligns with the work that you have already been doing. And what our goal has been to try to get some more specific recommendations before your work session at the end of July, I think July 24th, so that you can just have a little bit more data and information at your fingertips as you work through this process and make those decisions. I'm assuming that at that work session, you all will try to come up with a draft to put forward to get feedback on at the town halls. Maybe that's totally inaccurate, but in my mind, you would probably have some general ideas or decisions made by then, and then finesse it with the town hall feedback. And so what we were hoping is to get you some data by July 24th, just to help your decision making.
Tiffany, this is Austin. I can add to that too. And Mr. Dunbar and Mr. Rivera are also in the meeting, and they might have thoughts. The three of us as sponsors of the alcohol tax ordinance that eventually went on to become an actual alcohol tax, have sat down and thought about how to lay this out following the process that actually Ms. Altel laid out back in January. And so I think you're exactly right, Tiffany. The idea for June and July was that through committees, we would gather expert information and learn more about the services we could actually fund with the alcohol tax and how to strategize to best fund those services to get the most results. And so to me, this presentation, Mary Jo's presentation and Elizabeth, all the other presentations we've been seeing in other committees will come together to inform all of us. And then we'll have a comprehensive conversation about that on July 24th. And then move from there, we're talking with members of the public. We've obviously been doing that along the way as well individually, but in a more formal setting through the town halls, which Felix and I just, I think, tentatively scheduled the first week of August on a Wednesday and Thursday, I believe. Felix can correct me if I'm wrong. So, and then of course we'll come back together. So yeah, I see this perfectly in alignment with what the plan was, and appreciate you bringing people together, because it's difficult for the Assembly, particularly with the CARES Act and everything else we have going on, to convene 250, is it 250 organizations or just individuals?
Individuals.
So that's a big thing and something that we wouldn't necessarily be able to do. So I really appreciate this work you've been doing. Felix or Forrest, did you want to say anything about the process?
Yeah, I just wanted to add that, I think we had set up this process, or we had been discussing it in April, but obviously it's been complicated by the CARES Act, and that was something that we didn't really anticipate, and the sort of ongoing pandemic. And I think some of us have visions of this alcohol tax interacting in some way with initial CARES Act startup funding, which I know you mentioned as well, Tiffany. And I think that has made things a little more complicated. And so we might be making decisions about, we might be basically pre-committing certain alcohol tax funds before we had really wanted to. That is, we thought it would go through the end of August or September into the formal normal budget process. And I think that hopefully will still be the case for a majority of it, but there might be portions of funding that we, again, sort of pre-dedicate as we are spending CARES Act, because we're spending one-time CARES Act money with the anticipation that there'll be ongoing support from the alcohol tax. So that is just a wrinkle that we all have to work through, and it wasn't anticipated when we first put forward the tax, put forward the process. But I think it's necessary if we want the CARES Act money and the alcohol tax money to work in tandem.
Yeah, and the benefit of that, of course, is that they can, and this is a unique opportunity to do that, to have CARES Act money perhaps to get something started, and then alcohol tax money to continually fund it. So, and I know that Mr. Dunbar, Ms. Altel, and I and others have been talking about that. Any other comment? Oh, I'm sorry, Mr. Constant, go ahead. He had a question as well.
Not a question, just an assertion that although the funders, or excuse me, the original sponsors of this tax had a position in the beginning, we all voted yes on this to put it on the ballot. And while some of these priorities, it's kind of hard for me to read through all of these words and what they actually mean and are saying in terms of an actualizable project. This looks to have spent $87 million And so we have 13 million left to figure out what to spend, because this is every priority of every organization that ever was in Anchorage that never got funded for what they want to do. And so I have a lot of skepticism over what this actually means, and I look forward to having some clarity come out of what this is, because I just can't quite grasp it. And maybe I'm just too daft. Thank you.
Thank you for that comment. Tiffany, did you want to respond? You don't
I
have
would love to, and I have just also one other question. Through the chair, thanks very much, Assemblymember Constant. I hear you for sure, and we kind of share some of your concerns about how are we going to take something so huge and actually come together. And so we are also banking a lot on these kind of next meetings we have scheduled next week to try to get something that's very real and very tangible and say, okay, and because of this, we would like to see this many dollars go toward treatment beds because this is the need and these are the exact outcomes we expect to see. So I hear what you're saying. This is a very huge document and it's a lot to wrap one's head around. So thanks for sharing that concern. And then I also, and I don't know if this is the right place for it, but I am just curious if I heard Mr. Dunbar talk about some of the revenue that maybe has been pre-committed to go with the CARES Act funding, and I completely understand that, and I just didn't know if you already can share a rough dollar amount on that, just so that as we're trying to make decision or make recommendations, we don't way overstep what's available, or we could just do that and you can figure it out because that's your work.
Yeah, Tiffany, Mr. Dunbar wrote in the chat, nothing has been yet. He's saying it might happen earlier than September, October. And I'll just agree with him and make sure everyone knows there's not been any formal decisions on anything related to the alcohol tax. I think what he's referring to is conversations where we see a new opportunity to marry the alcohol tax with some of the CARES Act funding. And discussions around that, and that if we make certain decisions related to CARES Act, that might naturally lead into decisions with the alcohol tax. So just to be clear, there's been no decisions made. I think it's just conversations we're having in Rules Committee, in smaller groups in general. And he was just adding that it's a new wrinkle to what the possibilities are for this fund. Did you want to add anything, Mr. Dunbar? Does that accurately depict what you were saying? He says that's accurate. Meg, go ahead. One more question from Ms. Altel.
Thanks. Ms. Hall, have you been able to get, or are you aware of what the administration's proposed with regards to the alcohol tax? They have made some proposals, and I would want those kind of in the mix as the conversation proceeds. And if not, maybe we could help facilitate marrying up that information, because we've done a couple of work sessions where they've made some specific proposals from the health department, the fire department, APD, and then the library and the committee on homelessness. So I just want to make sure if we're having this conversation, we're all exchanging some information.
Thank you. I appreciate that. I think that I maybe saw one draft, but haven't seen anything more recent, so that's also on me, and I'll try to do a little bit more research to find that, or if I guess to say I'm not fully aware enough, but I would like to be, so thanks for bringing that up. Good to know.
And as far as I know, this is Austin again, in terms of any document and actual formal proposal, that was a couple months ago when Forrest and Felix and I brought it along with the administration as a starting point for discussion. So I don't think there's been anything released after that, but as Forrest noted, and Meg too, I think a lot of conversations about how to spend the money, and particularly in light of the CARES Act. Tiffany, are you done with your presentation, or do you have more to add?
Nope.
Any final questions before we move on to the next item in the agenda? And Tiffany, my understanding is you're going to be presenting this in other committees as well, or can you tell us about how this sort of plays through the July slate for committee work? Or maybe Meg or someone else wants to, whoever.
So just from our perspective, we are also on the agenda for public safety coming up next, which you will all probably still be on. Initially, we thought that by now we would have more specific recommendations. So at this one, we could talk about kind of the health recommendations, and at that one, we could be more specific about the safety recommendations. Since we don't have that yet, it would largely be very similar information. Maybe by the time we get to the homelessness committee, we will have more specific recommendations, but also I don't know that agenda's been out. I don't know if we are on that one or not yet. So that's kind of where we are today.
I think Ms. Saltel has a comment.
Thank you. Yeah, so we have a different plan with regards to the Committee on Homelessness because we are tying it to the anchored home pillars. And so we've been coordinating with Ms. Boyle at the coalition, and she is helping us pull together our presenters and our conversation around the remaining 3 pillars, 1, 2, and 4. For that meeting. So if there's a connection to be made, I could certainly make that. But that was kind of our plan. And we had announced that back in our May meeting. So I'd really like to stick with it, but doesn't mean there's not room to coordinate efforts.
Through the chair, just to say, we've been talking with them as well. And so that's just me with a lot of moving pieces this week, not having kind of circled back. I knew that they were on the agenda for your meeting. And so I think we're just going to try to keep working with them. They've been part of these meetings as well. So that sounds great.
Sounds great. And so, Tiffany, before we move on to the next item on the agenda, can you give us a sense for, do you expect to, with all of these partners you're working with, come up with a funding recommendation that's more specific? And if so, do you know when? It sounds like you were saying maybe within the next couple of weeks. Just wondering if we'll have that for our work session on the 24th, because that might be helpful.
Yes, so that is our goal, is to have you something by that week of the 20th. We have 3 meetings next week to try to get any kind of consensus or something close to that on specific dollars with specific kind of goals and outcomes attached.
Okay, great. And as a body, we haven't even talked about the meeting on the 24th and how we want to, make that, organize that. But I think it'd be helpful to have information from you, from other people in the community, and all of the information that the committees have gathered. So if there are no other questions or comments, we'll go ahead and move on to section 4 of the agenda. And I'm going to turn it over to Ms. LaFrance to talk about 4A and B.
Thank you, Madam Chair. So first off, for the budget priorities for 2021, we're going to be discussing and getting into more detail as we get farther into the budget process. But for a high-level view for now, first of all, if there have been any doubts before the pandemic on the critical role of our health department, it should be very clear how much our community depends on the Anchorage Health Department for public health and safety. So first and foremost, no cuts to the department is the highest priority, maintaining that continuation budget to support those core functions. And we'll be continue to look at those intersections too with public safety and homelessness when it comes to ACEs and behavioral health, and ways in which CARES Act money can be leveraged, as Mr. Dunbar and you mentioned, Madam Chair, to do even more with the alcohol tax. So that said, 3 other priorities would include funding for an epidemiologist, raising the compensation for public health nurses to be more in line with market values. There is a retention challenge with the department because pay isn't at market level. And then finally, an administrative office associate to support the functions of the department. We didn't break out the capital piece of it, but as Director Pineda mentioned, the current facility has some really serious needs. And we may include that for consideration in the list of priorities for the 2021 budget. So thank you, Madam Chair. Any questions or comments?
I don't see any questions or comments. I think we'll continue discussing these priorities, particularly in light of the community conversation around access to healthcare and to mental health care. And I know a lot of members are really interested in making sure we move in a positive direction. So thank you so much, Ms. LaFrance. We'll go ahead and move to audience participation. Do we have any member of the public which would like to speak? And if you're on the phone, you can unmute by pressing *6. Okay, it doesn't sound like we have any members. With that, I'll entertain a motion to adjourn.
Move to adjourn.
Thank you, Mr. Dunbar, and thanks everyone for presenting today. We'll talk with you all soon.